Hello, welcome everybody. See some familiar faces, of course, also some new faces. Welcome to our second guest lecture in our series this semester. We're very happy to have Menpa Sonam Pelmo with us. Before I introduce Menpa, just a few announcements. Please bear in mind that there is an online free of charge donation-based class on Shantideva's Guide to the Bodhisattva's Way of Life, the Bodhicharyavatara, Chapter 9, the Wisdom Chapter, and registration for that class will close on March 1st. So please refer to the website, or if you have Teams, then you can access through there. So also, we have a tiny break, but on March 5th, our next guest speaker is going to be Heather Moody, who is a visiting researcher from the University of Virginia, who will be speaking about the origins of the Dharma tradition. And the week after that, another guest lecturer, Martin Adam, will be speaking about, how shall I put it, ethical Buddhism and the possibility of ethical artificial intelligence. Okay. Miss anything? No? Okay, great. So Anshila studied for 9 years at the Central Institute for Higher Tibetan Studies, sometimes called the Central University for Tibetan Studies in Sarnath, which is in Uttar Pradesh in India. She was a resident doctor at Shechen Clinic and also the head of pharmacological services, yes? So she, in 2020, Anshila started her own company called Arura, where she has a clinic in Patan nowadays, but also has a medical factory, a pharmacology factory in Jorpati, which is not so far away from here. Anshila, you can connect with her already through her line of medicinal teas. We didn't bring a representation today, but if you see these little yellow boxes of wellness tea, that is the creation of Dr. Sonam Pelmo. Anything else I should mention? Okay, yes. So we are very, very happy to welcome her and to invite discussion on this extremely important topic. Yes, thank you.
Hello. Good evening, everyone. Thank you, Professor Denla, for giving my introduction. Thank you, RYI, for this wonderful opportunity. Today, my talk is on significance of Tibetan medicine in modern healthcare. First of all, can you please raise your hand? How many of you already know about Tibetan medicine? Oh, okay, fine. Okay. How many of you are taking Tibetan medicine in your daily life? Okay. So, in today's talk, I'm going to cover these subtopics: what is health, and introduction of Tibetan medicine, mental health, and Tibetan medicine's outlook on pandemic, and how to remain disease-free, and concluding remarks. So, what do we mean by health? WHO says it's a state of complete physical, mental, and social well-being, and not just merely the absence of disease or infirmity. So from Tibetan medicine perspective, health is the balanced state of three humor or nyapasum, lung, tipa, and pekin. And Tibetan word for health is tretin. It's it's a word of two syllables, tripa, tempa. Tripa means nowadays it's practiced in some of the Western countries and most of the Asian countries. It is one of the oldest traditional medical system of the world. In the world, there are four oldest traditional medical systems: Soarikpa in Indian medicine, or Ayurveda, and Greek medicine, and traditional Chinese medicine are known as the world's four oldest traditional medical system. And Soarikpa is, some assume that Soarikpa is just a Soarikpa or a traditional Tibetan medicine is just a remedy for few diseases, but it is not like that. It is a complete medical system. It's in its text. It has clearly mention about all the human anatomy, physiology, and the disease etiology and its treatment methods and diagnostic methods and pharmacology. Everything is inclusive in this Soarikpa text, so it is a complete medical system. Let's look brief on the history of Tibetan medicine. Since before Buddhism came to Tibet, the Bon religion was practiced in Tibet. So at that time, the Tempa Shenrab Myoche has taught so many, gave so many teachings about medical teachings. So his son Jebu Teshe compiled this and had a medical book called Sorik Bomshi. It is still now available and practiced by some Sorik Bomshi practitioners. So in the 127 BC, the first king of Tibet, Nyati Zempo, when he came to Tibet, few Bonpo scholars requested him to rule that area, but he refused by complaining that there is a poison in that area. But for that complaint, one of the Bonpo scholars called Tsibla Karma Welde, he replied that in Tibet we have medicine for the poison. That very statement shows that in the 127 BC, the medicine is there in Tibet. Now, in 245 AD, during the reign of King Hathoto Ringyinsen, so Buddhism started coming to Tibet. And in the history of Tibetan medicine also, two physicians from India, known as Bijigaji and Bilaganji, came to Tibet. And they are brother and sisters, and they treated so many patients, and their popularity spread far and wide. And once the king invited them to the palace, and his daughter gifted to the brother Bijigaji, and later their son also became a doctor, and he was the first physician of personal physician to king, and he's known as the first court physician of Tibetan medicine history. And now, during the reign of King 33rd King Songtsen Gampo, Buddhism started flourishing, and during his reign, he invited eminent physicians from the neighboring countries, like Bharadwaja from India, and he invited Hanwen Hangde from China and Galino from Persia. And they all together wrote a medical text called Mijik Peshencha, or Fearless Weapon, and offered to king. And when the Songtsen Gampo's Chinese wife came to Tibet, she brought so many traditional Chinese medical texts, and from that text, some medical texts were translated in Tibetan. So like that, Tibetan medicine was getting broader and more richer, and it started collecting the Soarikpa texts richer. And during the 8th century, the reign of King Trisong Deosin, he invited many 9 eminent doctors from the neighboring countries, like from Nepal, India, and China, Persia, and they held the first ever international conference on medicine in the Samye. And this is the Yuthok Yönten Gombo. He was he's also regarded as the father of Soarikpa, and he was during King Trisong Deosin's time, and he was there from the Tibetan scholar during the first ever international conference. And the current, this is the Gwishi text for Tantra, is a fundamental study text for the Tibetan medicinal doctor, and it is known as the Yuthok Yönten Gombo wrote a first draft of Gwishi, and later there came 2 Yuthok Yönten Gombos. So the second younger Yuthok Wenten Gombo was during the 12th century, and later Yuthok Wenten Gombo the younger completed the Guishi text, which we see currently. And this is the Guishi English translation version from Mensikang. So if you are interested to read the Guishi text, then it is also available in English translated version. Although there are more than 10,000 different types of Soarikpa books, but the main basic study text for the Soarik practitioners is the Guishi or the Four Tantra. Is it clear? So the theme of Tibetan medicine or theme of the Guishi, in nutshell, Soarikpa discusses on these four topics: subject of healing, means of healing, and how to heal and heal a physician. So the subject of healing is body and its disease. In the second tantra, there is about the human body, human body's anatomy and physiology was mentioned in detail in 6 chapters, and the disease, cause of disease, and classifications and location of disease, all are in 7 chapters. And now the means of healing is lifestyle, diet, medicine, and surgery. This lifestyle and diet also is mentioned in second tantra. Each has 3 chapters, and in medicine it's divided into 2 different types of medicine, like pacifying medicine. When we take the internal medicine, and it's just pacifying the diseases, and another is like evacuative medicine. It's like expelling out the diseases, like panchakarma, etc. So pacifying diseases, pacifying medicine is like decoction. I think you already know about the thang, which comes in a liquid form, powder, and it's pill form, and medicine in the paste form, like chawanprash from Ayurvedic chawanprash. And some medicine, it comes in a butter form, medicinal butter, and some in the ashes, some in the kenda form. Kenda is like, you may know about Shilajit. So Shilajit is also in a kenda form, and alcohol, medicinal alcohol, and precious pill, and herbal compounds. So sometimes we imagine that if it's the medicine in Tibetan, then we imagine just some pill. It's not like that. In Tibetan medicine, so many forms of medicines are there. These are all in fourth tantra. And evacuation medicine is like panchakarma, emesis, the vomiting, purgation, arine therapy, enema, and niruha is also a different type of enema. So in surgery or external therapies, it comes mild external therapy and harsh external therapy. It's surgery. And in mild external therapy, it comes venesection, tarsik tuklum chupa, venesection, moxibustion, and hot fermentation, tarsik tuklum chupa, and massage. This comes under the external therapies. And how to heal, to remain disease-free, and to strengthen the life, and to heal the diseases. So Soarikpa is not only for the diseased person. Soarikpa deals so many with the preventive measure. So in text, it has clearly mentioned that so if you want to be disease-free, if you want to prevent from disease, then you read the Soarikpa text. It's not only for doctor, or it's not only for diseased person to get out of disease. It's also for the so to prevent from disease, and to also strengthen the life, and to heal the disease. And the healer physician is in second tantra has a separate chapter on the qualities required for Soarikpa practitioners. So there are 6 qualities are mentioned in Sorik texts about the requirement of Sorik doctors. Like a doctor has to be intelligent. So here intelligent is not only knowing the Soarikpa text or Vishi text. It says that knowing all the medical systems and being a compassionate, being committed, skillful in body, mind, and speech. All the three has to be very skillful, like bodily skillful, like making in the traditional way. The Soaripa doctors, they themselves make all the surgery instruments. They have to know how to make all these instruments and all the medicinal procedures, and being diligent and being proficient in social ethics. So let's see now diagnostic methods. Although there are so many diagnostic methods, but the main 3 diagnostic methods in Soarikpa is diagnosis by visual examination, and diagnosis by touch or palpation, and interrogation. So in visual examination, we see the patient's tongue and urine. Although we see on patient's eye and patient's skin color, but the main diagnostic is by vision is the tongue and urine. In tongue, we can see in the healthy person's tongue has to be a red, a little bit wet, and without any cracks like this. And in the urine part. So in allopathic also they do a urine checkup, but they do under the microscopic technique. But Soarikpa doctors, they check urine through naked eye. So in the urine, we check. First we check the urine's color, its the steam of urine, and its smell. And when we stir, then we check a bubble, how many bubble and the sizes of bubble. And we check the sediments and discoloration of urine. All this checked in urine. And urine, when we go to Tibetan medicine doctor, so you have to take a first urine in the early morning urine. Is it clear? Is it make sense? Okay. So if you have question in between, then you can ask me. Okay. So when we take the urine, you have to be very careful about the container in which you are taking. It should not be contaminated. So if urine, if the container is already contaminated, and if the color of the container which you are taking is so too bright color, then it will not get accurate diagnosis. So now the second is diagnosis by touch or palpation. Although there are so many diagnoses through which we do through touch, but the main is reading, the pulse reading, or okay, pulse reading is the main part of diagnostic through touch. So here in pulse reading, we check a radial artery, and the doctors, when first doctors right hand and patient's left hand. So from the doctor's index finger, middle finger, and a ring finger are used to check the patient's pulse. In all these 3, we check the patient's organ and vital vessels, how how the conditions are there in the patient's organ. In index finger, the doctor's right hand index finger, we check the patient's heart, and upper side is we check about the heart condition, and here we check about the patient's intestine, small intestine, and in the middle finger we check about the patient's spleen, and in the lower side we check the patient's stomach, and in this side we check the patient's kidney, left kidney, and reproductive organs. So in the when we check the doctor's left hand and patient's right hand, we try to look at the patient's lungs and large intestine, and from the middle finger we check the patient's liver and gallbladder, and in the ring finger we check patient's right kidney and the condition of the bladder. So, in sorry.
Is it just possible to ask, because the right middle finger, what was it?
Right middle finger.
Yeah.
Okay, right middle finger of doctor or patient?
Yeah.
Maybe the
doctor.
Okay. Here, heart and intestine.
Yes.
And in middle finger, spleen.
Spleen.
Or spleen organ, spleen, spleen organ. You can ask in between, okay? You can interrupt anytime.
What's the lines here symbolizing?
Okay. In traditional way, we used to study like this. This is a root of root, and it's a branch, and it's a root of diagnostic method. So in diagnostic method, there are three branches. One is diagnosis by vision, diagnosis by palpation, and diagnosis by interrogation. It signifies this. Like this, it's easier to get memorized or get in mind. So in traditional way, we used to learn like this. Yeah.
When you say pulse freezing, is it counting the numbers?
No.
Or
No.
to
Yeah, I'm coming on that. So here we not only the counting, it's a way of how it beating, and how deeply and how in the surface level it is of beating. Like this, we see in patient's pulse. It's not just counting. In some disease, even the counting also counting can also diagnose the disease. Like in heat disorder, so the counting also it beats very fast, so that also we can count. According to Soarikpa, all the diseases can be summarized into lung, Tipa, and Pekin. So lung, Tipa, and Pekin is also the cause of disease, and also it is in the if it is in the balanced form, then it is it's called a healthy form, and if it is get imbalanced, then it gets disease. So in lung disease pulse, it floats beats like floating. It's like coming out from, like you can feel like coming out, and when we press deeper, then it is empty. We can't feel something. So and it timely it stops. It's not beating. So it's very irregular, and it floats like this of pulse movement is found in lung disorder. And in Tipa disorder, the pulse beats fast and a little bit in a like twisted form, and the pulse is so a little bit thinner. Some like in some blood disorders, we see the patient's pulse like it's very thick form, or it's and beating a little bit faster. So like this in Pekin pulse, it's like a little bit sunken. It's beating in deeply beating, and it's weak it's not beating so fast, also it's weak, and pulse is beating in deep, and it's slow in nature also. So that's brief about the diagnostic method. Now it's enough.
Vacant, it is weaker, slow, and the deeper region more
Yeah, it pulse beats in a deeper level.
deeper than.
Yeah, sorry, not so strong. Yeah, it's weak and it's a deeper. In lung, we see that it's like a floating out, and when we press deeper, then it's nothing is there. So if someone can come, and then I can check, and I will tell you. We can do a practical. Okay. So press the doctors. In female, we check first left hands, doctor's left hand, we take this. For male, we do the right hand from the doctor, and left hand from the patient. So this much we have to press. The first index finger we have to touch only the skin part, because a radial artery is going deeper. So the middle finger we have to press a little bit deeper to touch the inside flesh, and the last ring finger we have to press to reaching bone, because this artery is very deeper. That's why you have to press it like this. Here we see some kind of pecking. So it's beating a little bit deeper and slower. So if you want to see, then you can, in her pulse, you can see like a Bacon's pulse. Okay.
And then he told me this, I have too much tiba in the body. And then I spoke to my other friend who was also doing ANSI. And then she told me like if it is tiba, pagan,
Low.
or
Low.
it all starts from the formation of the embryo. Is it so? Like,
Yeah. I think you are talking about the bodily constituent.
yeah.
So all the so everyone, each and everyone are different. Like some are Becken natured, some are lung natured. Some the lung natured person has although I'm coming this topic later on. Okay, so I will talk it. I will talk it right now. So the nature of lung person is like a thin and black, a little bit dark in color, and is very mobile. He can't sit in one side and it's not getting lazy. It's not like he has to go somewhere. He's very talkative, and he has got a very sharp memory or thinking a lot. All these are lung natured person. So we can't say that he is a lung disease person. It's his nature. So the Tipa, I think your friend was talking on that. So the Tipa natured person is like they get angry very fast, and they have got a sharp memory, and they can't bear too much oily food. So like this in Pekin, so Tipa person, the body their weight and this medium size, and in Pekin it's like a little bit of fat and very lazy in nature. and fair in skin color, and too much sleepy. All these are Becken nature, so we can't say that he is a Becken disease. So it's
What are the nature of the Nibelungen and Bagan? Are they substance? I mean, it's kind of a little bit like the three humors in Greek medicine, right? Is it substances or what kind of? So what is the nature of those three? Are they kind of supposed to be substances or?
it is in the principle energy of our body. So that all the mobility, mobile and subtle, cold, and these are the characteristics of lung. Lung or vata or wind. Some did do the direct translation of lung is wind. But it's not only the wind we see in the outer environment. It's not mean by wind or lung our body. Lung means having a characteristic of mobile, roughness, subtle, and cold. All these are the characteristics of lung. So which we thinking and breathing, all this secretion of hormonal and all the evacuation of our waste, all are the function of lung in our body. And the tipa is fire nature, and it's like digesting food and to ripen our bodies, like nutrient and all this transforming into blood. All these are the work of tipa, to ripen and to digest. All these are the principal tipa energies function. And the Pekin energy is to sustain all these body parts and all our joints connecting. Most of the time we see that, okay, so you have joint pain and your liquidity of this fluid inside your joints are like getting it's short of all this fluidity. This all comes under the function of Pekin. Is it clear?
Yes, thank you. Thank
It's
you very
not
much.
a substance. It's a principal energy or functions of body. When these are in balanced state and when they functions properly in our body, then we are healthy. So if they gets imbalanced and if they get disturbed, then we start getting sick. So the lung disorder. In text, it has mentioned about the its dangche or its normal ranges also. So if it gets more, then we become a lung disease person.
We had a question online asking what decides why people have the kind of body that they have, or like why people have lung, trip, and Becken. So what is the reason for people having different constitutions?
Oh, okay. Okay, can I speak from here? So in Soaripa text, it has mentioned that during the conception, so our body is formed from the furthest sperm and mother's regenerative fluid and past its consciousness. So these three forms our body. So it depends what type of furthest fluid, furthest nature, and mother's what type of nature. And when you are in the mother's womb, what type of food is your mother is taking, what type of environmental factors. So these things make, when you come out, then it influences your nature. Okay. It's okay? So in the pulse reading, it's not only about the diagnosing the disease. There are 7 wondrous pearls also, which is sort of doing a divination. If husband and wife, if the husband is sick, then if the doctor can't check the patient's pulse, then we can read the patient's wife's pulse and predict the disease, whether he will die or whether he will survive. Like this, there are 7 wondrous pearls. Like if you are going for some war, then the main various, reading the main variables, we can predict, okay, then what type of war, and some, if the guests are coming, what type of guests they are coming, like this, 7 wondrous pearls are also mentioned in Swarikpa text. And another interesting thing is we have got a one called Latsa Tapa. Is from reading the one's pulse, we can predict how your life expectancy, lifespan, how long you are going to. For that, you have to be in a healthy state. In disease, we check the patient's radial artery in this side, but for life expectancy checking, we read a patient's ulnar, this side. Here, we check this side. Latsa, it's called Latsa. Let's talk about mental health. Although the mental health topic is very vast, and although it's very complex, but anyhow, we will look a little bit from what the Swarikpa perspective of mental health. So mental health issues has been huge problem in this current world. So we all see so many people suffering from different types of mental disorders like anxiety, depression, and stress, schizophrenia, bipolar, etc. And so these are all due to the disturbed in their mind. So let's look at the relation of body and mind. So body and mind, body is like a residence and mind is a resident. So as we have discussed earlier, the body is formed from 5 elements or 3 basic principal energies, lung, chipa, and pekin. So from in the lung and mind are interconnected. Lung is like a horse and mind is like a rider. So mind is rides or mind stays on the woman's lung energy. So the function of lung, as we have discussed, is breathing, and the lung energy is the characteristic of rough, lightness, cold, subtle, hard, and mobile. All this mind has also the same characteristic like lightness and mobile. So the lung and mind are interconnected, and the function of lung is like breathing, mobility, action of body, mind, and speech, and delivery of waste products and hormonal secretion. All these depends on lung energy, and there are 5 different types of lung energy are mentioned in Swarikpa text, from Sokjin, Kengyu, Kyabje, Menyam, and Thursil. These are 5 lung energy, different types of 5 lung. And from that, the Sokjin lung, the life sustaining lung, Sokjin lung, Chiorne, Tewa Tangshung, Gyoshin, Seko, Me Ukmup, Childo, Diba, Dekwajin. Lodang Ongpo session, Semjinche. The life sustaining lungs function is like all the respiratory function, and the main function is clearing the sense organs and holding the mind. And again, the second lung, Kengyu lung ni Kengyu lung ni Tewa Tangshu Seko Mich Umu Chido Diba Roda Umu Kengyu lung ni Tangla ne Nache Komo Gyushin Sijina Kodo Tensen. She means this and the second lung, it stays in chest region, and it is function is to all the speech, talking, and all these are the activity of lung. And the main thing is the memorizing and holding the memories are all the function of the second lung called Kengyu lung. That's the I'm going to, that's the part I'm trying to connect between the mind and lung. So mental illnesses like anxiety and depression. Now let's see the cause of mental disorder from Tibetan medicine. In Tibetan medicine, every disease's primary cause or the cause is kept as ignorant or not knowing the selflessness is the root cause of all the disease. In the Buddhism perspective also, that why we are in samsara, because due to ignorant marikpa, we are in the six realms due to the marikpa. So same here, due to marikpa or ignorance, and it causes all these afflictive emotions like Dwecha, Shetang, and Timu. So the distant cause of all the diseases is afflictive emotions like too much attachment and anger, hatred, or delusion are the distant cause of all these diseases. And here also in the mental disorder, excessive of all these afflictive emotions, this cause the mental disorders. And the immediate cause or the arousal factor is when the person is too much so weak and he has been in grief for so long time, and he's having so much mental work, and of course his diet and lifestyle, irregular of diet and lifestyle, and the evil spirit or other factor from outside, all this causes mental disorder. Let's look about the treatment part. So in treatment, there are several treatment methods like diet, lifestyle, medicine, external therapies, and meditation and positive emotions. So diet, what type of diet has to be taken by mental disorder is like you have to take a garlic or onion, jaggery, or milk, which the diet having a quality of heaviness or warm diet, and broth or non-vegetarian foods. And in the herbs also, spices also, the nutmeg and caraway are very effective for all the lung or the mental illnesses patient. And the lifestyle in Soaripa, it is advised that staying in warm place and accompanying with your close friends whom you can share all your feelings, and whom it's not only that share your feelings, but you have a concern on you and patience to listen your all the problems. That makes you feel relaxed for the mental patient. In the medicine part, although there are so many medicines for mental disorders, but some of the common medicines are Simde, Bimala, Agar 35. Here, Agar 35 means it has the Agar means is a main ingredient of the medicine, and 35 it has a component of 35 different types of herbs. And Shinkin 25, Agar 8, and the medicinal butters. All these are effective for the mental illnesses. Here you might be wondering that, okay, how it heals, how it affects the mental disorder by these medicines. So mental disorders are all the problem of mind. So how can some other outer substance help direct to the mind? You may be wondering that, but we have discussed that mind and lung are so much interconnected. So if we think a lot, then it gets disturbed to your lung energy. and later you will become a lung disease person. So like this, they are very interconnected. So the diet and lifestyle, medicine, whatever I have discussed before, are all the antidote for the lung. So once you give the antidote to your the horse, the rider and horse, then it also makes changes in the mental issues. So external therapies like oil massage, enema, and moxibustion on the lung points. Some of the lung points are here in the crown and here and this. Sorry, I didn't exactly. And the neck region and the center of the chest are and two palm and two center of the 2 feet. These are all known as a lung sang or the point of lung. So we can do a moxibustion or we can hit this part of the lung points. And arine therapy is known as a nasal therapy. So we can put the oil on some lung pacifying medicinal through nasal channel to calm down all this lung of upper part of body. And yes, of course, all of you know about the meditation's effectiveness on mind. So the accurate antidote or accurate medicine for the mental disorder will be the meditation. So it helps a lot. And so there's so many types of meditations are there. I think all of you know more than me about the meditation. So it directly helps, but it takes time. But meditation in Tibetan word is a gom, is to get gomba. It's like getting habituated. So you are suffering from mental diseases. So tomorrow if you sit for meditation, then this mental problem is gone. It's not like that. It takes time. So gradually you will get better. And positive emotions from Buddhist perspective, like being contentment. In Tibetan word, we say that Dechung Chokshe is not only contentment. Dechung is like having a few desire, only few desire. And Chokshe is a contentment, few desire and contentment. So if you too much of I need this, that, everything I need, then it leads to mental, it disturbs your mind. So having contentment and being patient when you get so much angry and all that, and being altruism, all these positive energy, positive emotions from the Buddhist perspective will definitely, it helps the mental disorder patients. So treatment are for lung and the meditation are meditation for the direct treatment for mind. So is it clear or is there any question on this? It's just a brief about mental health treatment according to Sorikpa. Yeah, sure.
So that's very helpful. I wanted to ask about the meditation because I guess ironically, I've met a lot of people who they do the meditation and from that they get the lung disease, especially like mindfulness of breathing. I've heard so many stories of that.
Yeah.
So what's the explanation for that? Because instead of becoming calmer, and it doesn't seem like they're doing the instruction wrong. So what's the reason for that?
Okay, so your question is they are doing correct way of meditation. Way. So yeah, the lung I think every in Soa Rigpa text, the cause of all the arousal factor of all the diseases, like your body, mind, and speech has to be in a balanced form. So if you do like thinking also, in meditation also, you are thinking too much, or in even speech also, if you are chanting too much, that you are saying that, okay, you are doing, everyone know that you are chanting, it's a good thing, but too much doing, it aggravates you. So thinking also, if you are thinking lot, I don't know if you in the limited way, according to his body type and body nature, if it is doing accurately, that too in the limit form, then of course it will not bring any complications like this.
The thing is, actually, a lot of people have reported even after like a week or like even, they were just, I mean, I don't know. I guess maybe it's just an anomaly, but it was very surprising because it was only maybe like a week
we
or
have
something.
to know what type of body nature he is, how many times a day, how the duration of meditation, how long he is doing. Okay, like this, it makes difference. Any other question? Okay.
So, explanation. Influence is wonderful. Asking questions for the people who are listening online.
Does Soa Rigpa have an explanation for why mental illness can, like, the chance of getting mental illness can be increased in family, like family descendants of chance to get mental illness?
I don't think so.
Okay.
I don't think so. If it is like a bodily disorder, then it's like inherited in the blood pressure or sugar. Okay, they say that, okay, it's inherited, it's my family, but mental disorder, no.
Okay.
Any other question? So,
It's a little specific, but
does it make sense? Okay.
you talked about Agasum, so
About 35 years.
so agar, what would be the main component in agar, for instance?
35 different types of so some are like sampo, do you know?
What?
Sampo, we call the nutmeg, cardamom, and nutmeg, cardamom, saffron. There's around 35 components, but sorry, I don't remember exactly.
Yeah, but they are
two sandals.
They are plant.
Two sandals,
They are,
few
yeah,
almonds.
they are
Yeah.
plant ingredients, so to speak, right? Coming from plants. They're from plants.
And few minerals also.
Minerals.
Yeah, minerals, very less. But I'm sure that 98% are herbs.
Okay. Yeah. Thank you.
Yeah, we make it in our factory. That's what I know.
I'm taking it sometimes.
Okay. Yeah, it's very effective.
Yeah.
It's effective for all the infections also, and as well as for all the lung.
Yeah, I'm one of the people who get a lung when they meditate. Yeah.
Okay. Any other questions? So let me share. Okay.
There are a couple of questions online. First question is, what are your opinions of secular mindfulness meditation? And if meditation requires any preliminary understanding of Buddhism, which is missing from modern mindfulness. So what is your opinion about that?
So, as I'm not an expert in meditation, but if you are seeking, if you are just a basic, if you are just, beginner in the meditation, then I think you can start from the basic, like a single pointed meditation, like a breathing, these things. You should not you have to go deeper like a secular and all these things. But if you are like in an advanced stage, then better you consult with some other meditation experts.
And then there is another question which says, some depression causes changes in the cerebral cortex. And can depression be cured by treatment and restore the brain to normal in medicine?
So we have to know how chronic is it. Okay, so if it is in the initial stage, then of course the meditation and by Tibetan medicine, Soaripa medicine, and life changes in the lifestyle, yeah, definitely it will get treated.
But does that mean that there is a point after which it can't be treated anymore?
Sorry?
Does that mean that if it's in a later stage and it's not in the beginning stage, then it can't be treated anymore?
So if it's later, I think it's a little bit problematic.
Thank you very much.
Any other question? So let's me myself being a mother of a small baby, I'm practicing this Vipassana since 2002. So I became mother in 2021. So when she started going to school and I being myself an working woman, so day to day, I get so stressed, Sometimes when we feed the baby, it takes so long time. It's like 1 hour it takes time to feed her. It's getting late. I have to get rushed to her school and I have to get to my work. So at that time, was in the beginning, I get very stressed. So one day I thought, I sat down and started thinking, okay, if all the time, or if it goes like this for a long time, then definitely it will harm my heart or harm the lung of lung or lung humor of my disease, and I will it's sure that I will become sick. So then later I changed that and being calm, and while I feeding, I started doing the mindfulness or some sort of my other meditational practices when feeding and when I'm dealing with her. So that calms my mind. So in every situation, so if it's like if your mind is very fast, and if it's like everything, I'm missing this and that, you guess it's too much stress, then it will lead you to the heart disease, and it will make you a heart patient. So that so what I'm going to deliver you is so calm mind, being a calm mind, and if you could, then practicing of all this compassionate and love, this all definitely helps in the mental disorders. Can we go to next slide, or you have some other questions? Now the fourth topic is on Tibetan medicine's outlook on pandemic. As you all know about the difference between the pandemic and epidemics. If the contagious disease is disease has outbreak in certain limited of area, then it is known as an epidemic. And if it spreads far wide and in multiple countries in the same time, then it's known as a pandemic. We have seen we have experience of pandemic in 2020. So for Soaripa practitioner and for Soaripa doctors, it is not new about the epidemic diseases. So in a Soaripa text, it has volumes of books are written on the epidemic diseases. So let's see what is the cause of epidemic in Tibetan medicine. There are distant cause and immediate cause. So the distant cause is, of course, all the due to the greed of human being, or the destruction of environment and pollution of atmosphere. All these are the distant cause of, in brief, all these are distant cause of epidemic diseases. And in the immediate cause, of course, the virus or bacteria itself, and the due to the destruction of environment, it changes in the climate changes, and other diet and lifestyle factors. This all leads to the epidemic diseases. So the treatment and protection from epidemic diseases in the medicine during the COVID time. So although there are more than 40 different types of medicines for epidemic or contagious diseases. So a few common medicines like Tasimarpo, Bangsi Chungi, Kyunga, Tonyanga, Rilmar are there, and these are the medicines which proved very effective during the COVID pandemic also. And before that, in 2002 also, we have seen about the SARS outbreak. So at that time, also Tibetan medicine practitioner in Tibet has treated many patients, and Tibetan medicine proved to be very effective on this epidemic diseases. They have treated many patients. So for the epidemic diseases, what type of diet you have to take, and it is necessary to take a nutritious diet and avoid all the sugary, dairy products, and fatty and preserved foods. And lifestyle like hygiene, and of course the meditation and exercises will help you to build your immune system. And from the protection of pandemic, here we have got some amulets, or the Napo Gujur is a pill with to tie in your neck, and it has to be sniffed. It as the disease, the entrance route of disease is through the nose and mouth. So when we sniff this, then it helps in the virus staying in this area. This is a incense powder for epidemic diseases. It's like it works like a sanitization, and it has to be burned and used like a sang. Some preventive measure from So from prevention of epidemic diseases through spiritual practices were also there, like practicing or chanting the mantra of Rito Loma Kyoma, like Om Pishe Zipana Shawari Soazotashimane saw this. And in the Tara Puja also, we have Rimle Thamchele. It's like if we pray to Tara Puja, also there is it will protect you from all the epidemic diseases. These are a few examples of protecting or preventing you from epidemic diseases. So many epidemic diseases, treatment and its cause are mentioned not only in our Swaripa but also in the hidden treasure. Terma, it's so many in the Terma, like in Rinchen Tersu, there are many other epidemic diseases treatment. It's medicine, and like it's amulet and sungkor sunga, which we wear, and like a korlo, like mandala type, which we, so sorry, I don't get the exact translation what it means. This type of prevention substances are mentioned in the Terma text also. So this is the one example. This is about Soche Dusi Phumpa by Guru Rinpoche and revealed by Tibetan Medicine. It discusses not about the cause, treatment, and the nature of epidemic diseases and what is the like a nature of virus or this germs, what type of and how what type of symptoms will get, and the treatment, all are written in this text. And it was Guru Rinpoche hide this in the there, and later Tibetan Medicine revealed this in 12th, I think it's 15th century. Till now we can see this and study these texts. And past epidemics in Tibet. So in Tibet also during 12th century, epidemic of like chicken pox or all this type of epidemic occurred in Ngari region. And so one of the treatment method from Terma, it helped a lot to get treated that epidemic of at that time. And like this in the 14th century also, outbreak of one epidemic diseases treated by Truptuk Thangtong Kelpo with his Rilmar formula. And in the 16th century, so the Gongmen Kunchok Delek has written a book on how he treated successfully about the epidemic diseases. These are the few examples that Tibetan medicine has also successfully treated, and it is effective in the epidemic diseases also. Now it's a last topic on how to remain disease-free. In Soric text, it says, Nelong Kenyi Tembe Tatupang. So you have to be very mindful about diet and lifestyle, which is a causing factor of all the diseases. So diet, in diet, in Soric text, it includes both the food and beverages. If sekom lecture lui dans sok soshin mena lobe nege tel sok jom. If you take proper diet, then it will help you to sustain life and it will nourish your body. If you are taking inadequate diet, then it will not nourish your body, and it will if you take improper or poisoned, like these days we see so many chemical food and packaged preserved foods. This will all lead you to the diseased state. And in diet part, Soaripa text says that whatever diet you are taking, if you have to be know the quality of diet. If you are taking the diet heavy foods like too much meat and too much oily, then make sure that you are taking only the half stomach. So dividing your stomach in 4 parts, so you have to take only the half part. It's hard to, it takes time to get properly digested. So if you are taking a light food, some vegetables and fruits, then you can take it full stomach. So it is easy to digest. You have to be very careful about food you are taking. And in the lifestyle part, in every moment you have to be very mindful. So in lifestyle, there are few important things like the natural urges. You should not suppress, or you should not force the natural urges, like forcing to urine and to suppressing your urine. This will also lead to some other disease like too much. If you suppress the urine, then it will formation of kidney and urethra stone tumors. On this, and if you suppress the sleep, and if you suppress the thirst also, if you feel too thirsty, then you have to drink the water. If you are doing if you're suppressing your thirst for long time, then it will lead you to the heart disease. All this like natural urges, it comes under incidental behavior. So it has to be treated at that time. And indigestion, as we have talked a bit about the diet, so it's important to look whatever food you are eating is whether it's properly digested or not. If the earlier food, whatever you are taking, is not properly digested, then you should not take the food. So make sure that if you are going to take a dinner, so make sure that your lunch or whatever you had before is properly digested. If it's not properly digested, then again, if you're going to take another food, then it will gradually, your continuous this type of habit will lead you to the indigestion. So indigestion is the cause of all the metabolic disorders, like diabetic and all the major metabolic diseases are due to the indigestion. And taking the cold food, raw food, and incompatible food, like taking in Soaripa, it says that taking a egg and fish together, that is also, that forms a toxic and it's not good for health. And also like taking a milk and fish together. There are a few examples of this incompatible foods. So in medicine, they're taking precious pills in the time, precious pills in once a month, according to your body nature and according to your disease. This will also help to remain you free from diseases. I think now this all. These are some picture. We are preparation of medicine in our medicine factory. First, we make all the herbs into powder, and later in this sugar coating machine, we make it peel and dry it, and it comes to the clinic. These are a few of our herbal products. Some oils. This is a pain relief oil, and this is stress relief oil, and this is a oil for nerve relief, for the nervous disorder like paralysis and tingling sensation of nerve pain. And this is hair oil, and this is a tultang. Tultang and nobu dintang is also a medicine which helped, which proved very effective during the COVID pandemic. And this is a stress relief tea. Sorry, the pictures are not clear. It's a stress relief tea, and this is a Trifala tea. It's good for digestive system, and it's good for cholesterol. And this is a lung detox tea. And this is immunity booster tea. And this is tea for diabetic and tea for arthritis. These are a few of our products, beside all the Tibetan medicine pills. So these all products are easily available around Bauda.
Questions?
Sure.
First, how to take the oil, and second, like for instance, the lung detox tea. If I took it. So second, the lung detox tea. If I took it sometime and I'm relatively okay, and then go on, is no good. Oh.
Sorry, I didn't get your question. Oh, you can. Do you mean that can you take it continuously?
Yeah. Also, if I'm healthy. Or
One tea bag a day, you can take it.
yeah. Okay.
Yeah.
Not more.
as Kathmandu is so many air pollution, we see so air pollution, so it will help to detoxify your lungs.
And the oil, how to take it?
It's an application. It's applying on the affected area, or it like if it is a pain relief oil, then if you have pain is located, then you can apply at that part. And about the stress relief, you have to apply in the lung point. We have discussed earlier about the lung points like crown and both the center of palm and center of feet and all this, and chest, center of chest. Stress relief oil.
So did you want to make a couple more final points and then a few minutes for question? Or?
Okay, now let's be the concluding remarks. So the text or the authoritative medical texts are written by Buddha and Bodhisattvas, who our Soric texts and all this, whatever we have discussed about the hidden treasure for the pandemic disease are written by not the normal person. They are written by the Bodhisattvas and Buddhas who can see the past, future, and present like object holding in your hand. And traditional Tibetan medicine is a complete medical system, not an alternative medicine, which we have discussed briefly. In mental health, by relying on Tibetan medicine and Buddhist meditation, definitely it helps. And still there are rooms to do research. And Tibetan medicine has full potential to contribute to prevent and curb the pandemic in the near future, and also needs thorough research. So mindfulness is the key to remain disease-free. So we have discussed that, okay, whatever food you are eating, in Tibetan proverb we say that mine thamche senei, all the disease of human being is due to its food eating habit. So being mindful will also keep you away from disease. So the last thing, so if you are too much self-centered, I, me, and this, so this I brings illness in your body. And if you are broad-minded, and if you are having altruism, and if you say, okay, we, and every time you are thinking about the broader aspect, then we brings wellness. So I'm going to thank you all for your patience. So thank you.
We do have a few more questions online,
Sure.
if that's fine. So the first question is, well, the person says, thank you so much for the very interesting and insightful presentation.
Mhm.
I just wanted to know if there has been any research carried out to assess the effectiveness of the treatment on the treatment of diseases.
Treatment of which disease?
Of like any diseases, like has there been
Many. Yeah.
Yeah.
In the cancer also.
Oh,
Yeah. In cancer patient also, cancer disease also, some Tibetan medicines like Yukyong Kanin and some precious pills has proved to be very effective on the cancer patients also.
yeah. Has there been like research, like
I think it's
clinical
just a
research?
clinical research. Yeah, research has done on this cancer also.
Yeah.
Few other diseases research papers are there, but even the cancer for the cancer patient also it has proved effective. Yeah.
Thank you. The next question is, can you please speak about the role of mantras on Tibetan medicine treatments?
Yeah. So in Tibetan medicine, when we make the medicine, we say that so like we all know about the okay, just for example, everyone knows about the cardamom. So cardamom, you know that the cardamom is good for kidney, and nutmegs are good for heart and lung. It is its substance potency. So so mantras, when we make a Tibetan medicine, then after completion of medicine, we put it and we keep it for the holifying under the drupchen or some, we do some holification of the medicine.
Thank you. And then there's another question. Could you please give some dietary advice to vegetarians, especially those who do not eat onions, garlics, etc.? So vegetarian mental patients.
Okay, for vegetarian mental patient, still you can take a milk. You can add, if you are making a vegetable soups, then you can add nutmeg and caraway, caraway or gonyu. Yeah, gonyu. It's called gonyu.
It's brown seeds.
Yeah. Seeds. Yeah,
carom
it's
seeds.
Seeds.
Yeah.
Not the carrot seeds.
Carom.
Yeah.
Okay, thank you. And there's many people who are thanking you for your talk.
Oh, thank you all. Thank you.
Sorry. One question. You showed a picture of your different products from Aurora. Do you have a shop somewhere where you can go and where we can buy those products? Or
These are all Utpala.
Oh.
Utpala, yeah. Utpali Bakery. Yeah.
Oh.
It's there in Utpala.
Bakery.
The nearest
Right
station
next door.
is Utpala.
Yeah.
Next door, yeah.
Okay. Thank you so much.
It's there in Amsterdam also.
Amsterdam.
Yeah, Amsterdam.
Okay.
Yeah.
Fantastic. Thank you.
But our factory is not too far also. It's in a walking distance. It's in Jopati. Jopati, yeah. There's a Tibetan camp. Inside there, we have our factory.
Thank you so much. I just wanted to ask, these days, a lot of like health gurus will say like cold plunge and this kind of thing is really good. But every Tibetan I talk to is kind of like scared of the cold. Like I'm living with a Tibetan family, and if I go barefoot, even inside, they'll say, like, you can't, you'll get sick. So what is the Tibetan perspective of like a cold plunge, and what is this like what is this idea of cold, like what does that do? Because from what like a Tibetan medicine perspective, what does that lead to? Because at least in America, where from where I grew up, maybe in other places in America it's fine, but everyone's eating cold salads and they say, oh, cold plunge is like so healthy for you. And there's some people, they're like, if you go bearish, or say, just go outside in the winter with shorts and a t-shirt on is probably healthy. Like, but I don't think any Tibetan is probably saying that. So
so we have talked about this will or the having habit of taking the raw food, and these are all the raw food is hard to digest. It will cause indigestion. But if you are habituated with this taking raw food since from your childhood, then it will not harm you. Yeah, it's clearly mentioned in text. Yeah, if you are habituated with these habits, then it will not harm you. Since you are used to take all this raw foods.
So I have a question concerning the, if you Tibetan medicine for the West, right? In the West, there are no Tibetan doctors. There are no competent Tibetan Menpas. Right? Is there a possibility to, in your opinion, still to bring Tibetan medicine to the West so it benefits people in the West without there being any competent Tibetan doctors there, actually?
Okay. Sorry, I asked you how is the Tibetan doctors.
Could you basically introduce Tibetan medicine into like foreign countries like Europe or the US, for instance, without there being? I mean, that is easy, right? It's much easier to bring medicine there than to have like hundreds of Tibetan doctors there. So you think that there's some room for bringing Tibetan medicine to the West, for instance, without bringing Tibetan doctors there?
Okay. So when we parcel or when we transport the medicine, the problem is from the country's legal issues, like they are not allowing some other herbal substances
Right,
from other countries.
the registration
That's the
problem is that's another problem, right? And just a question of, do you need a Tibetan doctor or could you use Tibetan medicine without a Tibetan doctor, so to speak? In some
okay,
instances,
yeah.
in some
Yeah,
instances.
I got your point.
Yeah.
Yeah. In minor problems, minor illnesses, yes, of course. If you know, there are some Tibetan medicine book just explaining about the medicines benefits. So after reading this, but the whoever taking this has to be what is it? With his own risk. Although the Tibetan medicine is very side effectless.
Yeah.
But I'm not sure whether he is, if he or she is not properly learned all this human anatomy and physiology and about the pharmacology, then how much it will be helpful. Although the medicines are very helpful, it will help, but how fast recovery and how better other complications has to be make sure that you can use that. Yeah. Or without doctor, if the medicine benefits are everything as there in the medicine, then you can use without doctors.
And just one last question from the online audience, just the last one. Sorry. What is your opinion about how well Tibetan medicine goes with Western medicine? Can they be mixed or?
Okay. You mean
like allopathy?
Medicine.
Yeah.
Medicine. Okay. Yeah, of course.
Thank you.
But if you're taking Tibetan medicine, you have to keep a gap of 1 hour and make sure that this medicine or previous food properly digested after that you take it. So the reaction of these two medicines should not harm the patient.
All right. Thank you very much.